Have you ever stopped to consider the magnitude of the drug abuse problem that is currently plaguing our societies? One particular substance, fentanyl, is causing a significant and devastating impact. This synthetic opioid, up to 100 times more potent than morphine, is contributing to an alarming increase in overdose deaths. Fentanyl was initially developed to aid in the management of severe pain, especially for cancer patients. However, its misuse has led to an epidemic of addiction and death. Illicitly produced fentanyl, often mixed with other drugs such as heroin and cocaine, is particularly dangerous due to its high potency and the difficulty in controlling its dosage. The United States and Canada are amongst the hardest hit by this crisis. In the United States, more than 80,000 people died from drug overdoses in the 12 months ending in May 2020, the highest number of overdose deaths ever recorded in a 12-month period, and fentanyl was involved in more than half of these fatalities. In Canada, the situation is equally dire. In British Columbia alone, nearly 5 deaths each day are attributed to illicit drug toxicity, with fentanyl detected in more than 80% of these cases. The effects of fentanyl abuse are not limited to the individual user. Families are torn apart, healthcare systems are overwhelmed, and communities are left to deal with the aftermath. The economic impact is also substantial, with increased healthcare costs, lost productivity, and the strain on law enforcement and public health resources. Efforts to combat the fentanyl crisis are multifaceted and ongoing. These include increasing access to treatment and recovery services, promoting the use of overdose-reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, and providing support for cutting-edge research on pain and addiction. To summarize, the fentanyl crisis is a complex and urgent public health issue. It is a problem that affects us all, either directly or indirectly, and one that requires a coordinated and comprehensive response. In understanding the scale and impact of this issue, we can better equip ourselves to address it and work towards a solution. We've discussed the prevalence and impact of fentanyl abuse, particularly in the United States and Canada. We've explored the devastating effects it has on individuals, families, and societies, and the substantial economic burden it places on our healthcare systems and communities. We've also considered the efforts being made to combat this crisis, from increasing access to treatment and recovery services, to promoting the use of overdose-reversing drugs and supporting cutting-edge research. It is our collective responsibility to understand and address this crisis. While the battle against fentanyl abuse is challenging, through education, understanding, and action, we can make a difference.